Hello, how are you? In today's video, I'm going to show you how to relieve that pain in your arm, on the side of your arm. That pain which is often related to shoulder problems, tendinitis, bursitis, or maybe for those who exercise a lot, are new to exercising, or do more intense workouts. Check out this question. Maria das Graças commented, "Hi doctor, I'm having a lot of pain in my shoulder and in the muscles of my arm." And a lot of people think that this little pain here is muscular. Most of the time, it's not the muscle that's hurting, right? The muscle isn't the cause of the pain. The cause of the pain is a tissue called fascia.
What?
Maybe you've never heard of fascia, or you've heard of it but don't really know what it is. Today, I'm going to show you 2 exercises to relieve this pain by improving your fascia. So before the exercise, let me quickly explain what fascia is and what it's for, so you can understand how we're going to work. Deal? Come with me. To put it simply, fascia is like a bag, a sack that covers every little part. Anyone who studies anatomy sees that the muscle has a layer that surrounds it, right? There's the epimysium, and even the muscle fibers have it too, the endomysium and the perimysium. The bone has the periosteum, which is a layer that covers the bone, the heart, the viscera, organs. There's the heart. For example, the heart has the pericardium. So every part of our body has this layer that surrounds it. And the name of this layer, which is connective tissue, is like a single sac that surrounds every little part of our body. That's the fascia. Now I understand. And the fascia serves to wrap, to cover each part of our body. It separates one part from another so that one part slides over the other. That's why the fascia, our skin, slides over the muscles. That's why when we get a massage, for example, the muscles are able to slide from side to side. You can move them. It's as if the muscles slide over each other and also slide over the bone. And we need that freedom of movement, because it's also the fascia that carries blood flow and lymphatic flow, the fluid that moves freely in our bodies. And it also conducts nerves. And last but not least, we can feel our own fascia. That's why fascia can be the source of pain. And let me explain what we're going to do today, what exercises we're going to do today. Here I want you to imagine that this is my arm. Look, just like that. Like Marcos Mion doing weave-a-ride. So here we have, look, in black, the arm bone. We have the forearm bone. So it's like my arm doing this. We have the muscles in blue, the biceps, which is this muscle. Let me lift up here so you can see my biceps. The biceps are here in the front of the arm, and the triceps are at the back of the arm. And we also have here, I drew in green the skin, just so we can have an idea more or less of where everything is. The fascia actually is not just one. There are a few different types, okay? There's the deep fascia, which is the fascia of the muscles. It separates the muscles from the rest. Here, for example, the biceps. And the triceps, actually it ends up being just one thing, but it works as if they were bags, separating one thing from the other. And we have the superficial fascia. It's a fascia that's closer to the skin, okay? It comes around here. Look, I'm going to draw it in purple. Now, my God, how colorful. It's like the connections between the skin itself and what's underneath, okay? And it's this superficial fascia, this fascia closer to the skin, that I'm going to show you how to work on, how to improve right now. I want to teach you 2 exercises so you can relieve this arm pain right now. And remember, I've already made a video talking about pain that goes from the neck to the arm. I'm leaving it here in the card. Is it here or here? I never know. I'm leaving it here in the card for you. Afterwards, you can watch that video, which has other exercises that can also help improve this arm pain. All right? So the first way to work on this superficial fascia, I'm going to roll up my shirt sleeve again. Man, the king is all tattooed. How is that possible? Let's go. What are you going to do? The first exercise is simply as if you were separating the skin from the muscles. Okay, right? You're going to hold the skin, look, of your arm like this. Look, it's not a C. You're not going to squeeze. You're just going to place your hand on your arm, push outward. The hand doesn't slide. I'm not caressing, okay? Place it and push the skin outward. Release, place it, pull the skin inward, outward, inward. You'll start at the elbow and move up to the shoulder as far as you can go, okay? It's not supposed to cause pain. Try to go only as far as feels comfortable. You see, I'm already going down. We're going to go up and down this path 3 times. So let's go. We've done the first one. Let's go up here or do the second one. You can do it with me. Isn't the goal to help you? And also remember, if you have any questions about arms or any other part of the body, leave them here in the comments. After all, these are the questions I answer here in the videos. So, if you want me to answer your question, please leave it in the comments. And don't miss out. There are a lot of people who ask questions. I record a video answering the question, helping the person. And the person doesn't watch it because they're not subscribed to the channel. So subscribe, turn on the bell, and enable all notifications. Because then YouTube notifies you. Every time I upload and every time I answer a question, YouTube notifies you and it will let you know when I answer yours. All right? Let's go. This first exercise already improves circulation and loosens up the superficial fascia of the arm. And if you're in pain, you should already feel the difference. It should have improved a little. You can even leave in the comments which of the 2 exercises will help you more. If it's the first one we just did or the second one we're about to do. Remember when I told you about the relationship between the skin and the muscles underneath? So we're going to work specifically on that relationship between the skin and the biceps and triceps, the arm muscles. For that, you're going to do the following. Look, just like I pull the sleeve of my shirt up here, we're going to try to pull the skin. Let's start with the front part of the arm on the bicep. Place your hand near the elbow, pull the skin up as if you were lifting the sleeve of your shirt, like this. Pull the skin up and you're going to do 5 movements with your arm. Stretch and bend. 2, 3, 4, 5. Move up the space of one hand, pull the skin, hold it. Don't let it go. Again. 2, 2, 3, 4, 5. If there's still room, if you can, place your hand higher. Pull the skin. Again, 5 movements. You'll notice that there's a sensation of pulling the skin, stretching the skin when you move. But there's also a feeling that it's stretching more on the inside as well. And it's this sensation of stretching on the inside that shows we're working, moving, and improving the fascia. In other words, we're controlling the pain that comes from the fascia. Isn't that cool? Yes. Many cases of tendinitis, like biceps tendon tendinitis, supraspinatus tendinitis, and bursitis, come from changes in this fascia. So many times you take medicine, do physical therapy, get treatment, get injections, and it seems like the pain always comes back. That's because the fascia still has issues. And here you're learning how to get better. Cool? The other part of the second exercise is to work on the relationship between the skin and the muscles at the back of the arm, with the triceps. We'll do something similar. Place your hand near the elbow and pull the skin. 1, 2, 3, 4, 5. Move up the space of one hand, pull the skin. 2, 3, 4, 5. If it fits, stick it, pull. 2, 3, 4, 5. So now you're going to observe what relieved your pain the most, whether it was the first rotation exercise or the second exercise, the one for the biceps and triceps with movement. All right, the muscle ones. Let us know in the comments if this helped. By the way, when you try it, if you're still feeling that discomfort when you raise your arm, I recorded a video where I talk about and show how to recover the movement to reduce that pain when lifting your arm, all right? I'll leave it here in the cards. I don't know if it's here or here. I never know, guys. And if this video helped you, if you learned something new, hit the like button, give it a thumbs up here. And your like helps you because YouTube understands that the video helped you and will show you more videos like this that can help you. Your like helps other people because YouTube understands that this video helped you and can help others. So it shows it to more people. And your like also helps our channel grow. Look, everyone wins. And I want you to understand that this channel is ours. So use these tips, these exercises, this video, and all the others here on the channel to help the people you care about. Your family, your mother, your father, your brother who lives far away. So make the most of the tips we give here on the channel to help these people. And this video you're seeing up here, I let YouTube choose the video that can help you the most. So how about finding out? Down here, I have a playlist about arm pain. Several videos that can help you and everyone around you. That's it for now. Big hugs and see you next time. Simon.